Hello everyone, I'm Dr. Tara Brown and I'm back for another exciting Clinic Minute. August is Wellness Month, and in preparation for today's topic, I looked up the definition of wellness. According to the National Wellness Institute, wellness is an active process through which people become aware of and make choices toward a more successful existence. And I like this one too from UMKC's School of Medicine's website. Wellness is not just about physical activity and good nutrition. It includes positive choices and a sense of fulfillment spiritually, occupationally, psychologically, physically, environmentally, and socially. When you present to your doctor for a wellness visit, your doctor would first want to collect a history. I review a patient's medical history. It may be really simple or perhaps complicated because they are following with multiple specialty doctors. But it's my job to make sure the treatment and plans are compatible. A social history includes how much we smoke or drink, for example. We review medications and also family history. With a wellness visit, we like to screen for anxiety and depression in all patients. Then of course comes the physical exam. And then I discuss age-related screening tests like PAPs and mammograms for females and PSA, prostate-specific antigen blood tests for men. Most men are relieved to know the dreaded prostate exam does not always come highly recommended for an asymptomatic individual, and most doctors reserve the exam for those patients experiencing urinary or other dysfunction. We typically draw routine labs and check urinalysis. Then I also like to include patient-specific study recommendations related to risk. Some men who smoke need an ultrasound of their abdomen to screen for abdominal aortic aneurysms, AAA for example. As you can tell, a wellness exam can open up a can of worms, but is very important. I try to practice what I preach, but life is too short, in my opinion, to not enjoy the finer things. I stay mentally well by enjoying my hobbies, and one of those is baking. When I first started with Herzog, my coworker, Jessica, behind the camera here, shared with me a black bean brownie recipe that I can't resist sharing. We'll give credit to the author and post the recipe in the email video. All right, so let's make some black bean brownies. It's really pretty simple. I got everything out to try to make it faster for you all, but just a can of black beans. You want to drain them and rinse them. So simple little strainer. So I drained and rinsed these previously, and you just dump them in an emulsion blender, I think this is what that's called. But a regular blender will probably work. I've just never tried it with that. So we have our black beans ready to go. And then to this, we just add everything in here, which makes it pretty simple. All right, guys, so the next step is to add 3 tablespoons of cocoa powder. And I know that this recipe is forgiving because I've done it a ton of times, so you don't have to be careful about it. After the cocoa powder, you can add coconut sugar. I actually add less than what the recipe calls for because I think they're too sweet. So you can just do it to taste. And then the chocolate chips. I prefer a really dark chocolate chip, but you could use a semi-sweet or you can mix them half and half. But we have to melt these babies down. So what you wanna do is take about a tablespoon of coconut oil. The recipe calls for 3 tablespoons total. So I just put a dollop in there and we're gonna microwave this. All right, so we have our melted chocolate. So we just pour this baby in. Perfect. And then we want to go ahead and add a couple more tablespoons of the coconut oil. Just behind the camera, we were talking about if these actually end up tasting like black beans, and they do not actually taste like black beans. They just taste like brownies. So I just eyeball that in. Next thing we want to add is a teaspoon of vanilla. I use the real stuff. Perfect. I always get the real vanilla, and we always like to smell it at home before I mix it up. My girls do. And then a teaspoon, half a teaspoon of baking soda. Next is the almond butter or peanut butter. I like almond butter, but you can use whatever you prefer. It calls for 4 tablespoons, and you can be picky about it or not, but I just usually kind of guess here. Wonderful. And then a pinch of salt. Great. So we have it all in our little blender here. Put the lid on and we're gonna mix this up. All right, so we blended this until it's nice and smooth. I just had to add a little bit more coconut oil to make it smooth. And you basically just end up with a nice brownie paste. So I line a pan with parchment paper and I put it into the oven 350 for about 20 to 30 minutes. I like them underdone and gooey, so I don't bake them for as long. And if I make a double batch, then I can use a 9x13, which is kind of nice. So anyway, I think you all should try this. And the best part about the recipe, at least at this stage, is that there's no eggs in it. So you can feel free to eat the dough and not feel guilty. So I feel like not everyone believes me that this is gonna be super good. So I brought a couple taste testers on here. Jessica and Peyton, let me know what you think. I think you're, See?
So good, actually.
So good. Wow, there you have it. Thank you all for joining me in this edition of the Clinic Minute. Until next time.